Welcome back, everyone, to another Women's Health Diagnosis webinar series. We are into part 3, and today we're going to be discussing bacterial vaginosis and vaginal yeast infections. And my name is Heaton, and I'm the Women's Health Clinical Liaison. So today we're going to be going over the definitions of these two conditions and look at some key facts, discuss causes and risk factors, look at signs and symptoms, how they're both diagnosed, go over some treatment options, and finally look at the key differences between them. So let's start with bacterial vaginosis. Bacterial vaginosis, or BV, is also known as nonspecific vaginitis, and it is a bacterial infection of the vagina. And what happens is that there are disruptions to normal vaginal bacterial flora. So a bacteria that's normally in the vagina will become disrupted due to the different reasons, which we'll talk about why that can occur later on when we talk about risk factors. But nevertheless, these disruptions are going to cause an infection within the vagina, which is one of the most common cause of vaginitis. And of course, vaginitis is inflammation of the vagina. And just a few key facts on bacterial vaginosis. Gardner and Dukes were the first to describe the condition in 1955. BV is the most common cause of vaginal discharge among women of childbearing age. BV prevalence varies across countries and population groups, but a recent systematic review and meta-analysis of the global BV prevalence among women of reproductive age range from 23 to 29%. In fact, BV is so common that it can occur in up to a third of female patients. Only about 50% are symptomatic. The absence of inflammation is the basis of the term vaginosis as opposed to vaginitis. Now let's look at vaginal yeast infections. Vaginal yeast infections, also called vulvovaginal candidiasis, is a fungal infection that causes irritation, discharge, and intense itchiness of the vagina and the vulva. It's a little different than your bacterial vaginosis. Some key facts of vaginal yeast. Vulvovaginal candidiasis was first described in 1849 by Stuart Wilkinson, and they are very, very common. Women's Health.gov indicates that 75% of women will have one, and about half of all women will have 2 or more over a lifetime, and about 5% of women will have 4 or more a year. So this can be a chronic condition. These infections are most common in women of childbearing age, and they are the second most common cause of vaginal inflammation, where bacterial infections are the most common cause. So now let's go into causes and risk factors of these conditions. Okay, so let's review the pathogenesis before moving to the cause of bacterial vaginosis. Normal vaginal flora in women of reproductive age is predominantly lactobacilli, and estrogen levels increase at puberty, stimulating glycogen uptake by vaginal epithelial cells. And of course, glycogen is one of the main food sources of lactobacilli. Lactobacilli produce both lactic acid and hydrogen peroxide. And vaginal epithelial cells also produce lactic acid as a byproduct of glycogenolysis. And of course, this makes the vaginal pH acidic, and hydrogen peroxide is also toxic against other bacterial species. Lactobacilli is thought to have a protective effect against vaginal and pelvic infections, and this is because of its low virulence factor. Thus, its predominance has protective effects. And lactobacilli becomes less dominant at menopause, which could make BV more difficult to diagnose. Okay, so what causes bacterial vaginosis? BV is the result of an imbalance in the vaginal flora. And when an imbalance occurs, healthy bacteria are depleted, allowing unhealthy ones to grow. So with BV, there are going to be a wide variety of bacterial species that can cause an infection within the vagina. And generally speaking, these bacteria species are going to be a part of the normal vaginal flora, but they've been disrupted in some way. And anaerobic organisms like Gardnerella vaginalis, the most common associated bacteria species in bacterial vaginosis. In fact, this condition used to be called Gardnerella vaginitis. And there is some research suggesting that Gardnerella vaginalis is the primary bacteria that actually starts issues with disruption of other bacteria flora. And another bacterial species that's been associated with bacterial vaginosis is lactobacilli. So alterations in lactobacillus appear to play a huge role in this condition as well. And it's more to do with the reduction in the number of this species that can cause worsening of symptoms. So some causative bacterial species. Anaerobic organisms like Gardnerella vaginalis is the most commonly associated bacterial species in bacterial vaginosis. In fact, this condition used to be called Gardnerella vaginitis, and there is some research suggesting that Gardnerella vaginalis is the primary bacteria that actually starts issues with disruption of other bacterial flora. And there are other causative bacterial species listed here, but another bacterial species that's been associated with bacterial vaginosis is lactobacillus. So alterations in lactobacillus appear to play a role in this condition as well. I mean, it's more to do with the reduction in the number of this species that can cause worsening of symptoms. Ultimately, all of this has to do with bacterial overgrowth, especially certain species that grow too many of certain species, and then alterations in other flora or other bacterial species, such as a reduction in lactobacillus. And then there are changes in vaginal pH, which can cause issues with these bacteria growing too much as well. So if you notice here, the normal vaginal pH is between 4 to 4.5. And if you'll notice here, lactobacillus and Gardnerella vaginalis are in normal ranges. They stay there and they don't do any harm. But as the pH rises above 4.5, you'll see how the vaginal area becomes a lot more susceptible to conditions like bacterial vaginosis. Okay, some risk factors of BV include the risk of BV is highest among females between the ages of 15 and 44. This age group tends to be more sexually active than younger or older people, and bacterial vaginosis is rare in people who have never been sexually active. Genetics. While the research is nowhere near conclusive, there is evidence that certain genetic mutations may affect the production of corticotropin-releasing hormone, or CRH, which plays an important role in regulating immunity and inflammation. And scientists believe that abnormalities in CRH production may affect vaginal tissues and trigger an imbalance in bacteria populations, especially during pregnancy. Lifestyle factors: having multiple sex partners, unprotected oral, vaginal, and anal sex. Of course, sexual intercourse can disrupt the vaginal flora by introducing new microbes into the vagina. And this may not only alter the vaginal pH, but it can strip away many of the healthy bacteria that support and clean the vagina. Microbes can be introduced each time there is intercourse. Douching can strip the vagina of its protective flora. And some special considerations: BV can increase the risk of other conditions and complications, and some of these include increased STD risk. Untreated bacterial vaginosis can increase one's risk of contracting sexually transmitted infections like chlamydia, HIV, gonorrhea. And according to a 2022 research review, the reason for this is because of the bacterial overgrowth in the vagina, and that can cause or increase the likelihood that the immune barrier within the vagina is disrupted, which can increase the likelihood of having an infection from an STD. Now, BV may also increase the risk of contracting herpes simplex virus type 2 and the human papilloma virus, or HPV. HIV transmission. Research shows that BV can cause up to 6 times more HIV shedding in someone who has HIV. So shedding refers to the amount of the virus present in bodily secretions. So increased shedding can put the sexual partner at a greater risk of contracting HIV during sex, even if one is taking their HIV medication. Studies have shown that women with both HIV and BV may be more likely to transmit HIV to their sexual partners than those with HIV. Pregnancy complications. Research shows that BV can trigger a variety of potential complications for pregnant people. And some of the potential complications of BV during pregnancy can include miscarriage, preterm labor, infants with low birth weight, placenta and amniotic fluid infection, postpartum endometritis, pelvic inflammatory disease after abortion, and increases risk to sexual partners. And research is still undecided on whether bacteria associated with BV can be transmitted by both men and women to their partners during sex. And it does appear likely that transmission can occur in heterosexual and homosexual sex. Other considerations: increased risk of HPV infections or reactivation of HPV patients, and there's increased risk of pelvic inflammatory disease. And it's important to look for fever, chronic pelvic pain, pain during sex that may indicate this. Bacteria can enter the reproductive tract anytime the cervical barrier is disturbed, such as during menstruation, or IUD insertion, after childbirth, miscarriage, or abortion. And when there is a buildup of excessive bacteria, can lead to bacterial vaginosis. And of course, BV is inflammation that can turn into an infection, and it could potentially cause PID. Okay, some other risk factors. Recent antibiotic use can alter the vaginal flora, and some antibiotics, like broad spectrum, have a wider target reach, which can wipe out normal vaginal flora. Decreases in estrogen levels, that can cause environmental changes, and it can cause issues with bacterial growth. Smoking is known to deplete two bacteria vital to vaginal health: Lactobacillus inners and Lactobacillus crispatus. And of course, smoking can cause the constriction of blood vessels, making it harder to fight infection when increased circulation is needed. IUD, copper-containing intrauterine devices, while effective in preventing pregnancy, can double the risk of BV in certain women. And according to a study from the St. Louis School of Medicine, the risk appears greatest in people who have an underlying imbalance in their vaginal flora and experience irregular bleeding while using an IUD. Bubble baths. The chemicals in bubble baths can change the vaginal pH, increasing the likelihood of having changes in bacterial species with potential overgrowth of causative strains. Vaginal yeast infections and causes. So Candida can be a part of a normal microbial population that's found on our skin. It doesn't cause infection. But in those individuals who are susceptible with certain risk factors, which we'll discuss shortly, there can be disruptions in the immune system or epithelial barriers or the vaginal environment. And the Candida species can enter and penetrate superficially into the vaginal mucosa or the epithelial lining of the vagina and lead to inflammation and very uncomfortable symptoms. The causative strains like Candida albicans accounts for the vast majority of yeast infections, and some other less common types: C. parapsilosis and C. dubliniensis and C. auris. But C. auris is more commonly seen in the immunocompromised people with severe systemic infections. The risk factors for vaginal yeast infections: diabetes is a major risk factor. Yeast cells that normally live in the vagina are kept in careful check by the minimally available nutrients in the acidic environment of the vagina. However, in people who have diabetes, vaginal secretions contain more glucose due to higher amounts of glucose in the blood. Yeast cells are nourished by this excess glucose, causing them to multiply and become a yeast infection. High blood sugar also interferes with immune functions that help prevent yeast infections. A yeast infection in people with diabetes can indicate that blood glucose levels are not well controlled, or that an infection is brewing in another part of the body. The presence of yeast itself also blocks the body's natural defense mechanism against other infections, increasing the risk for people with diabetes. Any infection in a person with diabetes poses a risk because blood sugars may be much higher or lower than normal while the body tries to fight back. There's certain medications for diabetes, like the SGLT2 inhibitors or the sodium glucose cotransporter 2 inhibitors. They include drugs like dapagliflozin or Farxiga, canagliflozin or Invokana, and Jardiance, empagliflozin. So these medications also have been used to treat heart failure and chronic kidney disease, but they increase glucose secreted by the kidneys into the urine. And genital yeast infections are more common in people who take these medications. Antibiotics is a very common reason for yeast infection. The lactobacilli normally found in the vagina produce substances and a level of acidity that inhibits yeast. Antibiotics tend to kill off the friendly bacteria, which allows yeast to grow. And using the broad spectrum antibiotics, for example, which has a wide range of targets, can ultimately destroy or kill off some of the beneficial bacteria within the vaginal cavity, which can lead to increase the likelihood that other microbes like Candida can come in and try to take over. Increased estrogen. Having an increased endogenous estrogen level raises the risk of vaginal yeast infections. For instance, pregnancy, those taking high-dose estrogen birth control pills, especially the older birth control pills, because there's higher estrogen levels in those, and women on hormonal replacement therapy are at a higher risk than others. After menopause, what happens is that the vaginal epithelial cells begin to atrophy, and there's less glycogen, and the normal flora, namely lactobacilli, are responsible for taking that glycogen and turning it into lactic acid via fermentation. And because there's less glycogen in the epithelial cells, and with less glycogen available, there's not going to be as much conversion of glycogen to lactic acid. And so lactic acid goes down and vaginal pH goes up, providing a more favorable environment for yeast to grow. Immunodeficiency. So if your immune system is impaired due to like corticosteroid medication, cancer treatment, HIV infection, or other causes, you can be at a greater risk for yeast infection. Some other risk factors: sexual activity. Yeast infections can actually occur without sexual activity, so it's not considered a sexually transmitted infection, but yeast can be transferred between sexual partners through vaginal, oral, or anal sex. So it is important to protect oneself with a condom. Genetics. Some people have a genetic predisposition to having vulvovaginal candidiasis. These folks, of course, tend to have recurrent episodes, and several genes have been implicated, such as a gene that encodes for mannose binding lectin, and others have higher levels of interleukin-4 that seem to play a role in suppressing anti-candida responses. So if you're suppressing that response, you're not going to get an anti-candida response. So higher IL-4, higher the likelihood of having this condition. Personal hygiene, wearing tight-fitting undergarments, douching, and inappropriate wiping from back to front instead of front to back are all hygiene factors that can create an environment that is beneficial for the growth of Candida. Some special considerations: a compromised host, clients with underlying debilitating medical conditions, of course, those with uncontrolled diabetes, or those who are receiving long-term corticosteroid treatments. They don't respond as well to short-term therapies. Efforts to correct modifiable conditions should be made, and more prolonged conventional antimycotic treatment is necessary. Vaginal yeast infections frequently occur during pregnancy, and usually only topical azole therapy applied for 7 days are recommended for using among pregnant women. HIV infection. The incidence of vaginal yeast infections in HIV-infected individuals is unknown, and vaginal candida colonization rates among HIV-infected are higher than among those who are seronegative with similar demographic characteristics and high-risk behaviors. And the colonization rates correlate with increasing severity of immunosuppression. And symptomatic vaginal yeast is more frequent in seropositive clients and similarly correlates with severity of immunodeficiency. Persistent or chronic infections, people who have persistent infections or chronic infections, 3 to 5 per year, should be managed by either a referral or assess for other health conditions. And here are your references. Now let's go into signs and symptoms. Usually with bacterial vaginosis, women have an abnormal vaginal discharge with an unpleasant odor. And this is often going to be the initial finding that alerts the patient that there's some issue. And some women report a strong fish-like odor, especially after intercourse. Discharge, if present, is usually white or gray and mucousy and is mixed in with normal vaginal discharge, and it can be thin. There also can be vulvar irritation, and less common, women with BV may also have burning during urination or itching around the outside of the vagina, or both. But most women with BV report no signs or symptoms at all, and this is why BV may actually be underreported. Now, with vaginal yeast infections, signs and symptoms of acute vulva vaginal candidiasis often present with vulvar itching and burning with some discharge, which can be white and thick, often described as a cottage cheese-like or curd-like. And these sometimes are called thrush patches. We can also see issues with labial erythema and edema. So the labia majora and minora are going to be erythematic or reddened and more edematous or swollen, which are all due to the inflammatory response. Now, patients have also described dysuria or burning upon urination, and these symptoms can be exacerbated just prior to menstruation, and the symptoms can be worse after urination or intercourse. Now, in chronic vulvovaginal candidiasis, symptoms are much more pronounced. So there's worsened redness and swelling, the vulva becomes thickened, and we can also see severe vulva itching and burning, irritation and pain. And oftentimes with chronic candidiasis, there may not be a discharge, especially in older patients, immunosuppressed, and type 2 diabetes patients. Now let's look at the diagnosis. Okay, with bacterial vaginosis, a history and physical exam is taken, and then the practitioner usually will check for vaginal discharge using a microscope, and this is called a vaginal smear or a wet mount. And the sample is prepared on a glass slide and checked under a microscope for bacteria, white blood cells, and other cells that are signs of infection. And vaginal fluid on a wet mount is going to show a key characteristic finding in BV, which is called clue cells, which are just epithelial cells that when looking at the microscope, they look a bit fuzzy. And the reason that they look fuzzy is because they're surrounded by bacteria, and bacteria are adhering to them. So it makes their outer edges look fuzzy. And this is what we call clue cells. And the diagnostic criteria that can be used to actually make an official diagnosis of BV is called the AMSL criteria, where 3 out of 4 of the criteria must be met. So there has to be clue cells on the saline smear. There's pH greater than 4.5. Now, testing with vaginal pH, this test checks the acidity of the sample. And the results of a pH test comes back as a number, and bacterial vaginosis involves a pH that, of course, is higher than normal. So anything greater than 4.5 is considered high. So high acidity is a sign of BV, but a pH test alone can't diagnose BV, so it's used with other tests. There's a thin gray homogeneous discharge, and then there needs to be a positive whiff test. Now, with the whiff test, the sample is mixed with a little bit of potassium hydroxide or KOH dripped onto the vaginal discharge to see if it makes a strong fishy odor, which is definitely a sign of BV. And that occurs in about approximately 70% of patients. So 3 out of 4 of the criteria have to be met. And then a PCR test, and this checks the sample for genetic material from harmful bacteria. And this is really used a whole lot just because it is more expensive. With the vaginal yeast infection, in diagnosing it, a medical history is made to see if a patient has had past vaginal yeast infections. And also, they will ask if they've had a sexually transmitted infection. Now, there are at-home tests for vaginal yeast infections, but there's no definitive diagnosis with that. It just tells someone whether their symptoms are likely to be from a yeast infection. The next step is a pelvic exam, where a clinician examines the vaginal wall and cervix, and they also look at the surrounding area for external signs of infection. And then from there, a vaginal cell sample may be needed, since these cells are collected from the vaginal wall, and they usually go to the lab for examination and for concrete diagnoses. And now let's look at the treatments for these conditions. Okay, so some common treatment for bacterial vaginosis. We're going to start with metronidazole or Flagyl. Metronidazole is cytotoxic to anaerobic microorganisms, and it is available orally and in a gel form. So 500 milligrams can be taken orally twice a day for 7 days. And the gel is 5 grams inserted into the vagina once a day for 5 days. And for recurrence, we have 500 milligrams of oral medication for 10 to 14 days. Another option is to use the vaginal gel for 10 days, then twice weekly for 3 to 6 months. The caution here is not to drink while taking metronidazole, no alcohol, because of the disulfiram reaction that can occur, where you have facial flushing, and you could also have stomach pain as well. And the other side effects of metronidazole include nausea, vomiting, diarrhea, metallic taste in the mouth, other GI symptoms, appetite loss, headache, mouth or tongue irritation. Clindamycin, which is a macrolide antibiotic, it's available orally in a cream, suppositories, and also in a gel form. The pill, 300 milligrams, taken orally twice a day for 7 days. 2% vaginal cream is available, 5 grams inserted into the vagina at bedtime for 7 days. The suppositories at 100 milligrams inserted at bedtime for 3 days. And there is a new vaginal gel by Organon called Saciato. It is clindamycin phosphate vaginal gel at 2% that just came out earlier this year for BV treatment in females aged 12 and older. Some other common medications used in BV, you've got Tindamax, which is tinidazole, and secnidazole or Solosec. And both of these drugs are amoebicides, and there are some side effects with them. So if you have side effects from metronidazole or clindamycin, you can use tinidazole, which is easier to take. It's a short course, lower cost than other prescription options, but it does have potential side effects like metallic taste in the mouth, loss of appetite, vomiting, nausea, constipation, stomach pain, tiredness, dizziness, and headache. Secnidazole or Solosec is available as granules that can be consumed orally. As far as dosing goes, tinidazole is 2 grams once a day for 2 days, or 1 gram once a day for 5 days. And secnidazole is 2 grams at 1 dose. But now secnidazole is significantly more expensive than other treatments. And just with clinical experience, sometimes that 1 dose doesn't work every time. So just something to think about. So recurrence can occur with BV. Sometimes it's due to antibiotic resistance, incomplete or successful treatment, imbalances in the vaginal microbiome. And the treatment options for recurrence include extended drug therapies and probiotics to restore that normal flora. So here are some alternative treatments. Probiotics. There's evidence that taking probiotic supplements daily may help treat and prevent BV, and a research review from 2021 suggests that oral and vaginal probiotics can be effective treatment and prevention option for BV. Garlic has strong antibacterial properties, and it's long been used as a home remedy for BV. Garlic can be taken orally, and research from 2020 looked at alternative treatments for BV, and it suggests that taking a garlic supplement tablet could be an option for treating BV. Boric acid, vaginal suppositories are commonly used to treat BV. According to the research in 2019, boric acid typically effective at treating both BV and vaginal thrush, and few side effects occur. Of course, boric acid is not to be taken orally, but it should not be used while pregnant. Okay, so treatment for vaginal yeast infections. For simple yeast infections, antifungals like buconazole, clotrimazole, miconazole, turconazole, and fluconazole can all be used. They can be OTC or prescription. They are the azoles as a suffix in their name, and they inhibit ergosterol synthesis. So ergosterol is part of the cell membrane of Candida species. So it inhibits the synthesis of that critical part of their cell membrane. So it's not able to reproduce effectively. And of course, these medications can come in oral cream or suppository. Just as a precaution, no oral fluconazole during pregnancy. It's usually 1 to 6 day regimen of an antifungal cream, ointment, tablet, or suppository. Okay, so treatment for complicated yeast infections. If patients present with severe redness, swelling, itching that leads to sores or tears in their vaginal tissue, or have more than 4 yeast infections in a year, they're pregnant, or if they have controlled diabetes or a weak immune system from medication or have HIV, all of these conditions are considered complicated. 14-day cream, ointment, tablet, or suppository vaginal treatment is indicated. 2 or 3 doses of fluconazole may be needed. Long-term prescription of fluconazole taken once a week for 6 weeks, or long-term use of a topical antifungal medication. Precautions: if patient is sexually active and the infection is recurring, may want to inquire if a sexual partner has a yeast infection. It could be transmissible. Avoid sexual activity or use a barrier method like a condom when having sex if the patient suspects they have a yeast infection or their partner has a yeast infection. So some alternative treatments for vaginal yeast. Probiotics can help to restore the bacteria yeast balance throughout the body, and taking oral probiotics can contain strains of Lactobacillus acidophilus bacteria can offer a number of health benefits, including helping bring the digestive tract and vaginal flora back into alignment. Oral supplementation can take several days to a few weeks to reach full effects, and some people use probiotics as vaginal suppositories to get results more quickly. Boric acid is a powerful antiseptic, can help clear up yeast infections resistant to other remedies. So boric acid vaginal suppositories can be used in combination with medications to treat vaginal infections. Just avoid using boric acid on broken skin, never take it orally, and it should not be used during pregnancy in any form. Oil of oregano, the extract and the oregano essential oils come from the same plant, but are different in application. So oil of oregano is also not the same as common oregano, Oreganum marjoram, which you'll usually find in the grocery store spice section. Now, for yeast infections, search for the oregano oil extract that's drawn from wild oregano, Oreganum vulgare. A 2017 study suggests that oregano essential oil may prove effective for altering the growth of Candida albicans. Now, research also suggests that coconut oil is effective against Candida albicans, and tea tree oil has antifungal properties, and studies suggest a combination of probiotics and vaginal suppositories containing tea tree oil can help treat vaginal infections. And there's been evidence that suggests garlic can also help kill Candida, though some strains can prove more effective than others. While more studies are needed, garlic solution on sores of the mouth have been found to be effective in helping to curb the growth of Candida, but more research is needed. So just to sum up, I wanted to just itemize the differences between BV and vaginal yeast infections. BV is the most common type of vaginal infection in people between the ages of 15 and 44. BV's primary causes are bacterial imbalances from douching and sexual activity. It's not a fungal infection like a typical yeast infection. And BV hallmark sign is a strong fishy odor. BV has other symptoms similar to a yeast infection, including changes in discharge, burning, and itching. And this can make distinguishing between the two infections difficult. A vaginal yeast infection doesn't cause long-term complications. Untreated BV can, and this includes an increased risk of sexually transmitted infections, preterm labor, and infertility. And unlike a yeast infection, which normally requires an antifungal medication, a prescription for an antibiotic is necessary to clear up BV. Clinical diagnosis is necessary to properly identify vaginal conditions for proper treatment and management. Please connect with us. We are a network of 503A and 503B compounding pharmacies providing innovative and quality pharmaceutical products and services through industry best patient care and solutions for customers and clinicians. Our clinical pharmacists can help guide you on hormonal therapies, hormonal testing, and provide options for all of your patients' needs. We have clinical resources that can help you and your patients, such as Consult RX, which is a nationwide VIP service that provides expertise and resources that go above and beyond normal pharmacy services for clinical consulting. Our functional medicine and anti-aging board certified team of clinical pharmacists and practitioners bring a combined 50 years of experience to provide the highest level of service possible. We offer VIP services to both patients and providers. And thank you so much for joining me today, and I hope that you'll join me for another informative webinar series. Have a great day.